Extend a hearty welcome to all of you on behalf of Chairman, DVHR Center for Climate Change. I would like to thank our founder chairman, Professor J. Srinivasan, who has taken his time to be with us today. I also thank Dr. Professor Anil V. Kulkarni and also Dr. Srinivasan, and also special thanks to Professor Parameshwar sir, who is for his untiring efforts in organizing every month one seminar, which is really useful to all of us. He chooses every time different topics, very interesting and useful, which makes us to lead a happy and healthy life. So thank you, sir, again. So foremost, I would like to thank today's speaker, Dr. Sudha Tinaikar, who has accepted our Professor Paramesh sir's kind invitation to be with us and to share with us her experience and thoughts. So thank you, ma'am, and it's a great honor. I also thank distinguished guests who have also come here and seated a little behind. Thank you, sir, on behalf of DVHR Center. We welcome you and all the students of our DVHR Center. So I would like to briefly briefly introduce about the speaker and then request Professor Paramesh sir to say a few words about the speaker, Dr. Sudha Tinaikar. So Dr. Sudha Tinaikar completed her MBBS MD Internal Medicine from Bangalore and MBA from in Hospital Administration from Canadian School Symbiosis Pune, and also obtained postgraduate diploma in medical law and ethics from National Law School Bangalore, and also has done a course on general counseling. Madam worked as an assistant professor of internal medicines at B.R. Ambedkar Medical College, Bangalore, and also worked as a consultant in internal medicine and diabetology in Lakeside Medical Center, Bangalore for 10 years as a clinical and also as a clinical coordinator at Columbia Asia Referral Hospital. So Madam is in private practice in internal medicine and diabetology since 1984, and most of her clinical practice involves patients with diabetes and other internal medicine disorders, especially focused on diabetes in pregnancy, systematic and metabolic disorders in pregnancy, postpartum medical disorders, and so on and so forth. So she has been a speaker in medical meetings, teaching programs and conferences, and teaching is her passion. And her students are now well-known consultants and are placed very well across Bangalore and across India. She writes on medical and social issues for some private magazines and newsletters. So thank you, ma'am. Thank you so much. I now request Paramesh sir to take over.
Distinguished professors of the climate change and invited guests and students. And this month is the World Diabetes Month. So on behalf of the DVHR Center Climate Change, Indian Institute of Science, Lakeside Education Trust, International Pediatric Association and Geneva, I request formally to welcome from, in the absence of Dr. S.K. Satish, I request Professor J. Srinivasan. He is the founder of this unit, separate unit 15 years ago. And he is a person with lot of encouragement for the research and all this thing. We feel very proud of him. And also, he is very innovative way. Analytical mind, he has it. And he is the atmospheric science. He was an IPCC report chairman for a few years. Now, more than that, we all say that carbon footprint you have to reduce 2 tons per person in India. Even though we produce only 1.05 ton per person, America produces 16 ton per person. Globally, 4 ton per person. He produces 2 ton per person. He walks from Malaysia to here every day. So by that, he can save nearly 2 tons. He don't have the car. If you don't have the car, 2.5 tons of carbon footprint you can save. This is what he preaches, he practices. This is something we feel very proud of him. And he did his early training in ITC in Chennai. Then his MS in New York and Stanford University PhD. He was in NASA also. And then he came back here doing that one. And also I feel he don't really mention about it. He's none other than Nobel laureate Sir C.V. Raman nephew. And we feel very proud. Sir, it's a pleasure to have you here. Formally welcome the people, sir. Thanks.
Good afternoon. Welcome you all to this monthly seminar that Dr. Parmesh has organized for the last 3 years, in which we have heard many eminent doctors talk about various issues related to environment and health. And especially in the diabetes, we have heard many speakers, but this is an issue which is so important to India that it is good that Dr. Parmesh invited another important person to tell us how to handle the issue of diabetes, which has been very high in South India, and it's also increasing with time. So we look forward to the talk, and I request Dr. Parmesh to introduce the speaker. Yeah.
Thank you, sir. The next item in the agenda, the introduction of the subject and the speaker. I think you have introduced the speaker, made my job much easier. And now coming to the subject matter, the burden of the diabetes mellitus, especially the type 2, is rising globally. Its impact is felt more in the country like India, ours. And understanding and manipulating of the environmental factors become very critical in our country. And interesting, type 1 diabetes mellitus has also been shown to be influenced to quite an extent by the environmental factors. And heat waves can contribute to diabetes, making it worse. And also cold ambient temperature is also affects the temperature. Ambient air pollution like nitrogen dioxide, suspended particulate matter less than 2.5 micron, and ozone and carbon dioxide greenhouse gas, they contribute for the diabetes to a certain extent. And also, we have increased the gestational diabetes. These are all the gases. And increase the insulin-resistant diabetes, increase the fat deposition in the body, that also contributing to diabetes, increase the beta cell dysfunction. I think to discuss with us, we have none other than a committed person, Dr. Sudha Tinaikar. She has been introduced. I have a great pleasure to welcoming you, madam. Take it over. Thank you very much.
Good evening, everybody. I'm so happy to be here, especially, I and Dr. Parmesh have been associated, working together for so many years. It's nice that, he asked me to be a speaker in today's seminar. And today I'm going to speak about how environment can influence diabetes. And of course, I'm not going to go into all the pathological, pathophysiological, clinical features and all which we normally talk about in a medical seminar. But here, it being a very, very mixed crowd, and most of you being scientists and postgraduate students of environmental sciences, I'm going to restrict myself to how environment can influence diabetes. And there is so much material that this 40 minutes that have been given to me, it's not at all enough. I'm just going to scan through or just going to introduce you to what kind of influences, how environment is affecting us and what aspect of environment is really going to play a role in which patient, we wouldn't really know. So just to see the whole broad spectrum of environmental influences, that will be the basis of my talk today. Not anything in specific, but in general, as to know what are the things that we are actually doing right now, and what are the things which we have to be careful about, because the diagnosis or appearance of diabetes, the control of diabetes, complications of diabetes, all of them are very, very closely associated with environmental factors. So let us see now how the environmental factors are going to really work. So this is the number game. Every year we have different numbers. Every organization related with diabetes gives its own numbers. But the only thing we can say is, that, the important thing is that thing called as pre-diabetes, or people who are almost likely to become diabetics, are forming almost, now we have about, these all India. I'm talking about India. I'm not talking about the world figures. 25.2 millions are IGT and pre-diabetes, and they're going to be 35 million by 2045. The number of diabetics, type 2 diabetics, along with, of course, this pre-diabetics, everything included, right now it is said different numbers are there by different, bodies. 77 million gone to 134 million by 2045. So you can just see the, the burden of diabetes. And most interesting thing, 57% of these people are undiagnosed. Many times they are diagnosed for something else. I see so many people who are referred for a cataract surgery fitness, and then I find that at that time they are found to have high HbA1c levels, high blood sugars, they themselves do not know. Or for a fitness for surgery, they come for some simple hernia surgery, and suddenly you find that it is this. So they're undiagnosed, and many of them are diagnosed incidentally. So you find that so many of them are undiagnosed, and how this one is going to, be impactful on life expectancy, financial impact, especially in a country like ours, where the contribution to the health, the budget for the health is so minuscule. So how it is going to impact, the life, not only the life expectancy, but financial impact. Recently on the World Diabetes Day, a report was released saying that 1 in 3 patients are not on treatment. Therefore, 33% of diagnosed diabetics are not on treatment, either because of denial or because they don't want to start the treatment. They don't accept that diabetes is a lifelong disorder which needs to be treated, or they want to go to alternate systems of medicine which promise a cure. We don't. We say you can manage your diabetes well, but it's lifelong. But there are alternate systems who say we will cure you and keep the patient for years together, and they are not on regular treatment at all. Then the next one, whether it's the environment alone or whether it is genetic also. Now it is said that diabetes it's known to be a multifactorial disease. Genetics influencing as much as environment, but right now, as we are progressing, in this 21st century, we are finding that the environmental factors are triggering a genetic predisposition for diabetes much earlier. A person who would have probably become a diabetic at 45 or 50, now you find them coming at 30, 35. So that way the environmental factors are triggering a person who's already genetically oriented, or sometimes there is no at least 2 generations. We don't know before that how many of them were diabetic, no family history, but then they come because of environmental factors. Of course, it's a complex interplay. Therefore, it is very difficult to say because of environment, this patient has got diabetes, or because of genetics. It's a very complex interplay where you cannot pinpoint on any one aspect. That's why we call it a multifactorial disease. And of course, now, modification or trying to deal with the environmental factors or modifying the entire environment is very important in prevention of diabetes in those who are likely to become diabetic, and also in the control of diabetes, and reversal of type 2 diabetes, which is going a long way in a lot of things about reversal of diabetes, which also has been over exaggerated and overplayed. But today that's not my subject actually, therefore I'm not. So all these are important where we modify the environmental factors. Then of course in India, it is more of environmental factors, though there is a genetic, because being Southeast Asians, we have got that diabetic gene in us, the Asian gene. Yes, but even then, several environmental factors we are there linked to that. Now let's see what are the various, there are many environmental factors. So let us go one by one as to what. Most important factor that has been found is actually rapid urbanization. Rapid urbanization has been found to be a very important thing because lifestyle changes. What our parents and grandparents, how they lived their life, their lifestyles, and now it is absolutely, that has been a change. More of mechanization, more of sedentary lifestyle, less of activity, less of exercise, all these reduce physical activity, and of course, eating habits, no healthy eating habits. 6 days in a week, probably people are eating out. No healthy food habits. So this is rapid urbanization. That is suddenly from a village or a semi-urban, or even I remember as children, though we were in Bangalore, we hardly went out and ate, maybe very rarely, once in months we ate at home. And there was nobody to drop us to school and pick us up from school and college. We walked, we went by bus. So all that has changed now. It has all changed now. So it's a kind of an unhealthy eating, especially with junk foods. So rapid urbanization is one of the most important factors. Then comes the dietary habit change. We were all brought up on whole grains. Now it is more of a westernized diet. Refined foods like pizzas and more of maida and more of refined foods and hardly any kind of, fiber content. The way we used to eat, our own diet, what we used to eat, what our guts are used to, what our bodies are used to, it's totally changed now. That at the age of 40 plus, our guts, our diet, body has to get adjusted to new types of diet inputs, which we have never been used to. Then next comes physical activity, most important. Manual activity has become less. If I remember Dr. Parmesh, I think when Dr. Mohan came here, and talked, we had a seminar and I was also a part of that. They had done a study called as a wealth index. They had taken in semi-urban and rural areas and urban areas, wealth index, taking 3 or 4 factors. Those who have a vehicle, those who have a washing machine, okay, and those who have mixer grinders. And they found that, the higher the wealth index, higher was the load of diabetes. Lower the health, this gadgetization, it was less wealth index. So that was so less manual activity. I don't think I do even 10% of the activity that I was doing 10 years ago. Even to go from, I was very much, I was really, influenced by Dr. Srinivasan's walking from Malleshwaram. For me to walk from my home to my clinic is hardly 5 minutes walk, sir, but I still take the car and go. And I was really so motivated when Dr. Parmesh told me that you walk every day at this age. Then increased use of technology, remote control. At least earlier we got up to change the TV channels and now nothing. You can sit in one place and do everything. Call on the telephone, get your Swiggy or Zomato to what is Swiggyization, Zomatization of the whole, society. So there's no question of any remote control, use of technology. Good, technology is good. Yes, we should use it, but we have become slaves to technology. Transport system, better transport systems. When we were young, we didn't have that much transport facilities as we have now. We had to walk or we have to wait for buses for a long time. So transports, less domestic activities, especially in females. We are finding diabetes rising very much in females, less physical activity, because for kitchen work and for everything, there are contraptions now and there is help available. So the homemakers are really not having that exercise which they used to have. That's why we find that most of the women here, especially those of the middle class and upper middle class, after the age of 40, 45, they put on so much of weight, especially the menopausal weight gain is very high in these patients because of all this. Then one study which shows inadequate green spaces and walking spaces in cities. There's no walking space. If I want to go for a walk, every 10 steps, I have to wait for a vehicle to pass or cross the road. So what happens is there is no continuous walking possible, less green spaces and less walking spaces. This was one study which really showed how urbanization has really done a great, disservice to it. Because there's no place to walk. Where do you walk? I tell my patients, you have to go for a walk. And they tell me, Yelli hogodu doctor walking ge. ಮನೆಯಿಂದ ಆಚೆ ಬಂದ್ರೆ ಫುಟ್ಪಾತ್ ಅಪ್ ಅಂಡ್ ಡೌನ್ ಐ ಆಮ್ ಸ್ಕೇರ್ಡ್ ಐ ವಿಲ್ ಫಾಲ್ ಡೌನ್ ಅಂಡ್ ಕನ್ಸ್ಟ್ರಕ್ಷನ್ ಇಸ್ ಗೋಯಿಂಗ್ ಆನ್ ಬೋತ್ ಸೈಡ್ಸ್ ಆಫ್ ದ ರೋಡ್ಸ್ there's two-way traffic where I can walk. This is a common question people ask me. Somebody should come with me and take me to a park, otherwise how can I go? These are all the practical problems we have, so green spaces, walking spaces, it's not. Then we have the obesity pandemic. It was, India, we rarely found very obese people earlier. Now we find that at least 2 in 10 are obese. They need not be morbidly obese, but they're definitely overweight. So actually now, because diabetes and obesity are so, so closely associated, there was a term coined also called as diabesity. Obesity and diabetes together, it was a term coined also. Not much is used now, but then how closely they are related to each other. Of course, we have already seen that because of, reasons, high calorie foods. We eat all high calorie foods, long hours of sitting in jobs for younger people or at home also for homemakers, increased screen exposure. Naturally, all the time, 24 hours, the TV is on and somebody sitting in front of the TV, munching something, or cell phones. All the time we're sitting and looking at the screen exposure, limited physical activity, access to food any time of the day. Midnight, you can ask a Zomato fellow to come and deliver you a pizza or something, and there are advertisements. So easy access to food, which was not there earlier. And then perimenopausal age. Hormonal changes, perimenopausal. Normally also perimenopausal age, women have a redistribution of weight. But now we are finding that they are becoming frankly obese. And of course, laziness. That's one thing. We have all become very lazy because of all these things. And is it only urban or rural? Both. It's not as if we don't find obesity in rural areas. We find obesity in both, but urban areas, we find that the obesity has, increased. Now, socioeconomic factors. What are the socioeconomic factors? That is Western world versus India, if we take, there it is said that low socioeconomic groups, like those who are in, especially in the, the black regions and all that, they don't have, access to healthy food, and therefore cheap and healthy options like a burger or a pizza or something, and they are putting on weight. Whereas here in India, the socioeconomic factors are, of course, junk food, increase in the junk food, easy accessibility of food. At the same time, in India, there is a limited healthcare facilities. Many of them are not diagnosed. Though they are diagnosed, they cannot afford treatment. Many of them don't have insurance, no insurance for outpatient treatment. So what happens is limited healthcare facilities, less exercise, and of course, we have seen obesity. In India, especially malnourishment. A child who is malnourished or a pregnant woman who is malnourished, it is definite that the child later is likely to, possibly land up with diabetes. Urbanization, slums, they are not, they eat whatever is possible. All these are there in our socioeconomic problems in India. And especially in slums also, it's not that all are malnourished, but they are, what you call ill-nourished. They eat the wrong kinds of foods. That is what the problem is. Then, of course, that is our Dr. Paramesh's favorite topic, air pollution, pollution. So what kind of environmental pollution? Rapid industrialization. And we don't have proper method of disposal of industrial waste and industrial fumes. Exposure to pollutants and pesticides. Okay, industrial pollutants, pesticides. Then we have air pollution, especially the particulate matter of less than 2.5. Nitrogen oxide, ozone, as just Dr. Parmesh talked about. Then, of course, smoking. Passive smoking, it's as good as, none of us are really non-smokers now. Either we are active smokers or passive smokers. So we are influenced by that. And food pollution, adulteration, so much of food pollution. That is there. So especially these pesticides which are used to ripen, artificial ripening of the fruits, to keep them for a long time, cold storage saved fruits being sold after one year of harvest. So all these are definitely their influence in diabetes. How? What is the mechanism by which all these happen? That is, it's called as endothelial damage. They cause inflammation. All these small particles, pesticides, they get into the endothelium, the thin layer inside the blood vessels, cause inflammation. And diabetes is known to be an inflammatory disorder. Inflammation, endothelial inflammation. So it's called as an inflammatory disorder. That these things cause what is called as an oxidative stress and inflammation. And then all these can cause insulin resistance, which also Dr. Parmeshwar just introduced. There are these things in all these environmental pollutants, certain things called as endocrine disrupting chemicals. These endocrine disrupting chemicals are the ones which cause insulin resistance. And therefore, whatever normal insulin I'm producing also is not getting into the cells and metabolizing sugar. Then, of course, frequent infections because of air pollution. Asthmas are so, Dr. Parmesh is a specialist authority on childhood asthma and childhood lung infections and air pollution. So, this is because of frequent infections, frequent exposure to medication. So every time I see patients, my diabetics, who are 4 to 6 courses of antibiotics in a year they receive. And now there is a huge adult vaccination program, which is as elaborate as a pediatric program. Every year, influenza vaccine, then pneumonia vaccine. Of course, it has got in a herpes vaccine, this vaccine, that vaccine. So frequent infections and exposure to medication. Because of infections, frequent antibiotic usage, frequent steroid usage. So medication also, that also gives rise to all this stress of the stress and, increase or difficult to control blood sugars. Then most important aspect now, everybody talks of stress. And if you ask anybody why, what is the problem? Is stress, doctor. I'm highly stressed. Everyone is stressed, right? From a nursery going child to everybody. And it has been said that school-going children, primary school children are so much under stress because of, student stress, then job stress, so many. The stress, environmental stressors, all these, socioeconomic pressures. You must get 100% marks. You must go to engineering. You must be better than that fellow. You must get this kind of a job which is paying you this socioeconomic pressures. Population density. So much of population, more infections, less walking spaces, more, all. So population net traffic density, how much of fumes the vehicles are just fuming out. Traffic density is there. Then traveling time, work traveling time, 3 hours, 4 hours, 5 hours in a day, people are traveling. That is also a biggest stress. Then coping mechanisms are becoming difficult at home also and at workplace also. Coping mechanisms are really. Then incidence of chronic stress related disorders. Young people getting, especially the IT industry, I find a lot of stress related work. Long hours of work, night shifts, sleep deprivation, circadian rhythm disturbances. Working in the night, daytime they are sleeping all the time, eating their lunch, dinner at 12 o'clock in the night. All these things. I recently had a young girl, 22-year-old, who presented with a severe pyelonephritis, that is kidney infection, just a 23-year-old, and we found that her HbA1c was 10%, her fasting blood sugar was more than 250, her postprandial was more than 400. She didn't even know about it, no symptoms. She's working in a night shift, and her meal, the last 12 o'clock in the night, she eats a heavy dinner. And she's there working throughout the night. She sleeps at 5 o'clock in the morning, gets up again at 2 o'clock or something in the afternoon. Again, it's a very heavy dinner, goes for work from 5 o'clock in the evening. So if at 12 o'clock in the night, our circadian rhythms are not meant to eat a large meal at 12 o'clock in the night. That do office offered, you can see what kind of food many of these IT industries offer. Tempting food. So they eat that at 12 o'clock in the night. Then higher incidence of mental and emotional problems. Mental health is really now a very great issue. They're on medication, and most of the psychiatric medicines are going to worsen the diabetes control, or diabetes appears in them. Then, of course, we have socio-political conflicts. Let's not forget addictions. So much of addiction to nicotine, alcohol, recreational drugs. All these are also smoking. Any diabetic, we say stop smoking. They say 1 or 2, no. All or none it is. Smoking will cause insulin resistance at the level of insulin receptors. Alcohol also, there is a limit to which a diabetic can take, or a person who doesn't want to develop diabetes can take. But when it goes over that, and for a long period of time, that can cause problems in the liver and in turn have problems on control of diabetes. Lastly, stress, loneliness, especially in older people. The empty nest syndrome. Children are all out, or there are only 2 elderly people, 1 couple just staying in loneliness, or there is 1 person, the partner is gone, children are not there. So much of loneliness. So these are all the stresses. Then, of course, noise pollution. Many articles have come on noise pollution. Persistent exposure to noise pollution is one of the very great risk factors for developing many types of metabolic disorders, including diabetes. Then long hours of exposure to screen, especially those who are working in the IT industries. Then we have breaking family units, single parents, very stressful. Breaking family units. Now there is a term, I didn't know, I heard it recently, called a grey divorce. After 25 years of marriage, there is a divorce. That's called as a grey divorce. At the age of after 50, going for a divorce. Great. Very common now. Okay, that is a stress, naturally. Then, breaking of single parents. Single parenting is not easy. It's very difficult. You have to be a breadwinner, you have to be a child supporter, you have to be everything. So a single parent, very stressful. Neglected senior citizens. Senior citizens are being neglected naturally. Even though they are staying with their own children and family, they are neglected. Then education stress in children and adolescents. I'm sure Dr. Parmesh will have more to say on this. How our education system itself is, starting the stress from a very young age, from primary school itself. Okay. All these are the things, that can, contribute to the appearance of diabetes. Then, of course, we have physical health, mental health, chronic medication, metabolic health, which interact with diabetes, like lifestyle disorders at very young age. People are hypertensive at the age of 25, 26. I've got so many patients, who are between 25 and 35 detected hypertensive for the first time. High lipid levels, high blood pressures, pre-diabetics. Within 2-3 years, they become diabetics. So at a young age, major psychiatric disorders. Psychiatric disorder itself is a stress, and the medications that are given for psychiatric disorders are definitely, the diabetes worsens with them. Then multiple medications, long-term multiple medications for various reasons, steroids and this and that and all that. I have very young patient, 42-year-old lady who has inflammatory bowel disease, not diagnosed for a long time. Recently, I had to make her go through some tests and we diagnosed her to be having Crohn's disease. She was on steroids, naturally, and immunosuppressants at 42. Within 2 years, she developed diabetes. No family history, no genetic predisposition as far as I can go back, but this is there. So long-term multiple medical therapies, psychiatric medical therapies, gut microbiota disruption, very important factor these days. Gut microbiome has been associated with so many disorders. Cardiac converts, ischemic heart diseases, but at the same time, even diabetes. There's a huge work done on diabetes and gut microbiota. Because of the disturbance in our eating, because of wrong foods that we eat, there is disturbance in the gut microbes, which is one of the reasons which causes that. And metabolic diseases at a very young age, other metabolic diseases. Then we have cultural practices. This is also environment. Cultural practices, changes, attitudes. So there's more socialization now compared to earlier. Opportunities are more. Excessive availability of food. Go to a wedding and see the buffet there. Okay? You see the spread of buffet there. And you go to a 5-star hotel for a brunch on a Sunday. See the number of people that are there and see the spread that is there. So easily excessive availability of food now. Earlier it was not available. Now it's available. Alcohol, nicotine, recreational drugs have become common. There's nothing wrong. Earlier people were afraid or ashamed, but now it's nothing. The only way of socializing, come on, yeah, let's go and have a drink somewhere. Oh, come on, let's have a smoke. So that is what it is. So alcohol, nicotine, recreational drugs. Of course, then advancing age, social isolation, loneliness, no family support, which I already talked about. Last thing is nuclear families. With joint families, the support system was good. But now with the nuclear families, the support system is not. Both the parents, both the couple working with no support, dependence on external supports. It's very, very stressful. Then healthcare access. How much healthcare access people have? As I said, only 1 in 3 diabetics receive treatment. That is in urban areas. Forget about rural then. I don't know, maybe 2 in 3. So why? These are the very reasons why there is lack of, healthcare access, especially in India, especially in rural areas. Lack of professional healthcare access in remote areas. No screening facilities, though the ADA and Indian Diabetes Association, all of them talk about screening procedures, but they're not followed. Undiagnosed pre-diabetes, clinical diabetes, metabolic disorders, not diagnosed because there are no symptoms. Mental and psychological disorders, not diagnosed. Denial and avoidance of screening and treatment. You ask somebody who is getting frequent upper respiratory infections, you tell them, see, it's not, not normal to get every month like this, get your blood sugar checked. Let's see whether you're a diabetic. They don't want to get it checked. No. Why should I get my blood sugar checked? I don't want to get my blood. So there is avoidance and denial. Lastly, quackery. There are so many quacks who are willing to say that why you want to go to a doctor? I'll give you something by which you'll never get diabetes. I'll cure you. All those things. Quackery is there. We have to compete with the quacks. Dr. Parmesh will know that. We have to compete with the quacks, so that our patients get good treatment. Then, of course, we know genetic predisposition. That India is a country where there are diverse genetic backgrounds. It's not one particular type of, genetic background, multiple. An Eastern Indian person genetically is totally different from a South Indian genetically, different backgrounds. And naturally, environments are different, though it's one country. So here, genetic predisposition being multiple genetic backgrounds and environmental factors also, as I have already discussed. So we always think that environment influences only type 2 diabetes, but it does affect type 1 also. And food, toxins in food, pesticides and water triggers, pesticides in food and water, they trigger the autoimmune system, especially, they can get deposited in the pancreatic cells and they can kill the beta cells which are producing insulin. That's been known. Frequent climate change is just Dr. Parmesh mentioned. Too much of fluctuation in temperatures, high temperatures, suddenly change in temperature, exposure to viral infections. And any viral infection can cause pancreatitis and cause diabetes. Excessive exposure to antibiotics in childhood affecting gut microbes. Nowadays, for any upper respiratory infection, any cough, 1 day cough and cold, children are being given antibiotics. And that happens 3-4 times in a year. What happens to their gut microbes? So from a young child only, the gut microbes are disturbed. Then vitamin D deficiency. Children are not going out and playing in the sun. They're always inside. Vitamin D deficiency is one of the important, what you call as aspects of diabetes. We have to check, even in adults it is so. But vitamin D deficiency in a child can predispose to type 1. Pollution, as I already told you about air pollution, water pollution, food pollution, adulteration, stress. Children are not free from stress today. We had wonderful lives as children. We didn't know what stress was. Till we went to medical college, we didn't know what stress was. But today, from a school-going child, it is something that it is stressful. Then maternal age, very important. Now the maternal age is going up higher and higher. The first child is after the age of 30 years. That also is one of the reasons why we are finding that in higher maternal age, the chances of the child becoming diabetic is quite high. Birth weight and growth. Very low birth weight children and they put on weight suddenly because of these artificial foods and all, they're likely to develop then unknown environmental factors. And now just doctor was telling me about somebody, I mean, finding uranium in underground water, like this. Just imagine exposure to this kind of a water. What can happen? Maybe most of our pancreatic cells in a child may get destroyed by these heavy metals and other things. Then why should we worry about the environmental triggers? If we really are interested in reversing pre-diabetes, we can't reverse an established diabetes. It's not possible. We can control it. If we want to at least, reverse a pre-diabetes, then we have to worry about the environment. Prevent pre-diabetes, conversion to diabetes. If you're already a pre-diabetic, conversion to diabetes, we can to some extent postpone or prevent by managing environmental triggers. Better management and better quality of life for the diabetic patients. Environmental triggers, if they are handled well, then the control of diabetes, appearance of complications, they can be, improved. So these are many more references are there. So much work has been done in this. So I just very few of them I have put in here. And very interestingly, the popular science journals are having more on this topic than actual medical journals. In medical journals, you'll find, but these other science journals, they are the ones who have loads of information on diabetes and environment. And I think this is all that I have to say about environmental influences. I have just given a bird's eye view because each of the subheadings which I have given is something which can be discussed. Every one of them can be discussed to a larger. One can be taken as one particular topic where any number of references can be given. But I have just given an kind of a bird's eye view of how many factors are there, and can we recognize which are the most important factors in our patients or in our families, and see that we can at least try to deal with those factors. Thank you for a patient hearing. Thank you, Doctor.
Sudha, what I can say, you covered so well, prepared so well. Thank you very much. I think, as you know, 70% of the disease comes environmental pollution. 2017 WHO data says in India, 70% is from the air pollution, 20% from water, 10% from the other chemicals and all this thing. In them, 70% related to the air pollution. 70% of these non-communicable diseases, allergy and asthma, as you rightly pointed out, to less than 2.5 micron, they cross the blood vessels. There is small clots, and it will carry it even in the placenta. Here, womb to tomb, it can affect, and it is all the vital organs will publish. Lung takes the major brunt and all this. You covered so well. Psychosocial-economic burden of the diabetes, you covered it very well. And genetics, you covered. I think we also non-communicable. Genetics is a brick and mortar. Environment is an architect, brings out the disease. You covered it very well. And rapid urbanization. I think Bengaluru is a known fact. We had 15 lakhs people about 10, 15 years ago. Now 1.2, 1 crore, 20 lakhs. I think nearly we engulfed almost 1,209 villages. There were gomalas, green space for the animals and the human. So every human being need about, as the greenhouse you covered, we need about 10 square meter per person. We have only 2 square meter per person in Bangalore. Where do they go? Green, we have to maintain the greenery and all this thing. You covered it very well. And also dietary habit, you covered very well. And green space, you covered in city. And so new term has just prepared now. I think yesterday only I received from the European Academy Allergy and Immunology guideline. They wanted my comments about 20 pages and then I went through it. I sent a comment. Indoor air pollution in India has come down 58% as of 2020 report from the ICMR. They focused only on that data based on the cooking fuel. Urbanization, we have got so many chemicals, sprays and all this, the pesticide, whole lot of things. That they have not covered. So I think we are, that's what I commented on that one. Indoor air pollution coming from the volatile organic compounds. All these things contribute significantly. Urbanization, we are not washing everything. Washing machine is there, pesticide, and also nail polish, whole lot of things. They contribute, sprays and all this thing. They're contributing more. That's what yesterday I sent my comment to the European Academy. It will be published on end of this month. So you covered those things very well. And gut microbiota is gut and brain equally connected. That's why we recommend us having a cesarean section where the maternal birth canal germs can colonize in the gut. That has allergy and asthma non-communicable is much less in them. You covered it. And circadian cycle, you covered very well. I think circadian cycle, each animal, birds, everything, they have this. Plant also has circadian cycle. For us, ಹಳೆ ಕಾಲದಲ್ಲಿ ನಾವು ಕನ್ನಡದಲ್ಲಿ ಹೇಳ್ತಿದ್ವಿ, ಊಟ ಮಾಡಬೇಕು, ಆಟ ಆಡಬೇಕು, ಓದಬೇಕು, ಮಲ್ಕೋಬೇಕು. This is what circadian cycle they had it. I think healing occurs in the natural sleep at night time. So the melatonin is the healing hormone. It will be starting secreting at 9 p.m. until morning 7:30 p.m. Whatever the inflammation happens, it heals. Nature has provided that. Without having good sleep, you end up a lot of problems. Stress, whole lot of things will be coming there. So with this type of thing, and also you said you can prevent the diabetic march from pre-diabetic march by environmental control, and we covered very well. I'm really thankful. So we covered. Now it's open for any question. Please feel free to ask. Yes, madam.
Even for example, your idli batter, fermentation will go on. Even if you keep it in the fridge, it can't be zero fermentation. It will go on. Okay, and there are certain bacteria which will be growing in that. And even our, whatever you call the vegetables being stored for days together or months together, weeks together, they will lose their nutritive value. That is there. That is why, it is said that better to get fresh vegetable. But I don't know in today's world what is really a fresh vegetable. Because in the shop itself, they would have bought it, from cold storage, which has been stored. So, I mean, whatever is available, yes, we have to. But definitely long storage, it has natural degradation by itself. And those which are, because they're using pesticides and other things, the effect will be more, more getting into the. So it is definitely, we are in a kind of a catch-22 situation, What is fresh in today's world, I don't know. Really, unless you grow your own vegetables and eat it, I think. Otherwise, I don't know what we are eating.
So these numbers make us diabetic for a long time using this kind of things.
See, it doesn't mean it will make you diabetic, but your gut microbiota will definitely get affected. And that is one of the contributing factors. Or you may land up with some H. pylori infection or some kind of irritable bowel or even inflammatory bowel diseases. And then, of course, it's one of the contributing factors, but doesn't mean that if you store food in the fridge for long time, you'll become a diabetic. That kind of a cause-effect relationship we cannot 100% say. Thank you.
Any other questions? Any question?
Madam, taking carb, you see in our Indian, almost we take 3 times carb every day. I think it tends to affect in the process of food.
See, taking carbs is okay if you have that much of exercise to burn the carbs. Now, what has happened is, we have no exercise, but excess load of carbs we are taking. But at the same time, these new carbs, which are, the so-called, I mean, it's good, okay, nowadays there's quinoa and all those things. But the thing is, we don't realize that our guts, are they prepared for a new type of a carbohydrate? So we cannot prescribe these things like a blanket thing for everybody. Like, am I used to it? From childhood, if I've grown up on rice, now, after 60, can I just suddenly change over to a millet or to wheat or something? I don't know, because I will not be able to do that. So yeah, reducing the carbs and increasing the proteins and fiber is definitely a good thing now, especially when we don't have the exercise necessary. Because we have seen villagers, the amount of rice they eat or ragi they eat, but they work also equally hard. Whole day they are in the fields. Do we have that kind of energy burning? No. We have accumulation of carbs and then convert it into fat, gets into the liver, gets into the subcutaneous fat. That's what is happening.
If there are no questions, on behalf of the Debate Center Climate Change, we accept a small token of appreciation. We want Professor Srinivasan to hand over. And after that, we have a picture. And this will publish on bulletin. All of you should join us for the picture.